The American Health Front is a presentation of Medical Media Group and the following physicians and healthcare organizations.
Today on the American Health Front, advanced robotic technology offers superior accuracy and new promise for patients with cancer. Lasers are fast becoming a part of the world we live in today, as well as being instrumental in revolutionizing spine surgery. If you or your loved one are terminally ill, quality of life and comforting care is of the utmost importance during the last months and days of life. And stay with us as we learn how periodontal disease can affect your overall health. And if you're missing teeth, dental implants are the next best thing to your real teeth. Hello everyone, I'm Ernie Bjorkman. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Houston edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could really change your life. So stay with us, because there is nothing more important than your health. First on the American Health Front, finding out you have cancer can be frightening news, but thanks to new technology, non-invasive treatments offer new promise. St. Luke's Radiation Therapy and CyberKnife Center in Houston is proud to offer experienced clinicians to deliver the latest and innovative cancer treatment, the CyberKnife system. CyberKnife delivers superior accuracy using state-of-the-art advanced robotic technology, as well as continual image guidance. Physician specialists collaborate to design the best treatment plan to achieve the best outcome.
The CyberKnife robotic radiosurgery system is a non-invasive device for the treatment of many types of cancerous and non-cancerous tumors throughout the body in sites that include the brain, the spine, the lung, the liver, the pancreas, and the prostate. This treatment, which delivers high doses of radiation with great precision, offers new hope to patients who have tumors that are in surgically inaccessible or complex areas, or who want an alternative to surgery. Unlike other radiosurgery systems, this has several advantages. It does not use painful skull screws. It can give more than one treatment, and it can follow tumors as they move. More than 100,000 patients have been treated with this technology in over 200 sites throughout the world.
CyberKnife targets tumors and lesions while minimizing damage to nearby healthy tissue.
Cancer physicians and surgeons have learned that when large doses of radiation are given over a very short time, the effect on eliminating the tumor is much greater than with traditional radiation. For example, with stage 1 lung cancer or with limited spread of cancer to the lung, these more effective doses can be safely given with the CyberKnife technology. CyberKnife is a robotic radiation device that can follow or track tumors when they move. It treats the tumor with pencil-thin beams of radiation given from hundreds of directions. By treating this way, we can precisely focus and concentrate the radiation, which results in minimal risk of damage to the surrounding normal organs.
You come in and go right on back there and lie down, and the machine does its work, and you go home. They don't feel a thing. Don't feel a thing. It's just, it's a miracle.
St. Luke's Radiation Therapy and CyberKnife Center. Experience the difference. Personalized care and world-class technology. The perfect match.
If you'd like more information about anything featured on today's program, or if you miss any of the important numbers that will be shown throughout our program, please call 1-800-984-2010. Our staff will be happy to direct you to the medical professional that could be of particular interest to you.
Being able to walk, run, bend over, or lift things is something that most of us take for granted. But there are millions of people in the United States who can't enjoy or perform simple everyday activities, and their daily life is limited because of chronic back or neck pain.
My problem was at the L4, L5 level. I had 2 herniations that were pretty large. They impinged the sciatic nerve, and so it just made doing life impossible without pain meds, which has a lot of negatives.
Board-certified orthopedic and spine surgeon Dr. James Gattiali with the Center for Laser Spine Surgery offers customized treatment for problems from simple neck or back aches to complex spine conditions. They'll help you find the answers you're looking for with innovative diagnostic methods and minimally invasive techniques.
The conditions that we treat most often are those that are the same as traditional surgery. The ideal patient, of course, is one with radiculopathy, preferably from a herniated disc. This is treated endoscopically very effectively. We also treat the bony stenosis from aging process particularly. This can be also effectively treated using an endoscopic burr. We can also manage other pathologies around the spine, such as the facet-mediated pain, sometimes discogenic pain. What we're doing here is exactly the same surgery as would be done open, but it's done in a minimally invasive manner without destroying the surrounding structures. As far as advanced diagnostic methods, the main difference between people who are going to do a procedure endoscopically, minimally invasive, is that they have to really pinpoint the exact location of the pathology prior to the surgery. Hence, we do more pain blocks in order to isolate the pain generator.
Now let's explore how minimally invasive laser spine surgery has revolutionized spine treatment.
Endoscopic laser spine surgery is a procedure that accomplishes the same as an open operation, but without the collateral damage. The incisions are the size of a grain of rice. It's comparable to performing a knee arthroscopic surgery, where the exact same procedure is performed open or closed. The difference is that the patient here is awake, responsive, can tell us when the procedure is complete, can go home the same day. There are no sutures involved. It's simply band-aid surgery. There's a healing time is faster, and the recovery time is faster, simply because the collateral damage done is so minimal.
I'm quite happy with the situation, and it's improving, and I'm looking very much forward to much better quality of life.
I was really surprised that I would say 95% of my pain is gone. Like, I haven't had to take any pain meds since the surgery, which is a huge, that in and of itself is just an enormous blessing. But for reasons I don't understand, a lot of the pain that shouldn't have been attributable to the herniations has resolved.
The Center for Laser Spine Surgery, where your pain ends, your new life begins with maximum results and minimal recovery.
American Health Front is a production of Medical Media Group and 2010 Productions.
You may have heard the term hospice, but do you really know what it means? Hospice allows the terminally ill to spend the last days, weeks, or months of their lives in comfort, cared for by their family under the supervision of a medically trained team. We visited Gulf Coast Hospice of Houston, whose staff is committed to help enhance the quality of life by providing pain management, spiritual and social support, as well as other professional services.
Hospice care is about hope and love. We take care of our patients during a very difficult time. When they have been given 6 months or less to live, we come in and give them some hope in their situation, meaning we come in and take care of their symptoms, manage their pain, manage anything that may be providing pain to them or discomfort. We make sure that they are living their last days with as much comfort and dignity as possible.
Gulf Coast Hospice of Houston knows the value of superior care and provides love and support during this difficult time.
Our staff comes into your home, wherever you reside, and take care of you with love and hope in a difficult situation. Hospice care manages your symptoms and makes sure you are living your last days with comfort, peace, and dignity. In hospice care, we focus on the physical, spiritual, and emotional needs of the patient and family. And I think that's what I love most about hospice care, is that we not only focus on the patient, but also on the family. We provide education, we provide support, and then we provide comfort to the families in knowing that we are there for them whenever they need us. Our nurses on call 24 hours a day, 7 days a week, and we are readily available to come out and make visits. Our team of physicians, nurses, social workers, chaplains, certified nursing assistants, and volunteers all work together to make this process in life the most peaceful one as possible. Our hospice program offers bereavement care up to 13 months after the death of a loved one. We contact you on a monthly basis and make sure you are progressing through your grief, and if any resources need to be made or any referrals, then our bereavement coordinator will do so. Our bereavement coordinator also goes the extra mile by making home visits or site visits just to make sure that you are progressing with your grief.
How I came involved with Gulf Coast Hospice, I was looking for a service to help my father-in-law, who's 82 years old, to take care of my mother-in-law. Every time I would go to the house, I would go, oh my God, he has to do that all by himself. So when I found out about Gulf Coast Hospice and their service, whereas the LVN, RN, and the doctor goes and see my mother-in-law and make sure that she's taken care of, and he doesn't have to drive her to the medical center to see a doctor, it could be done at home, it would make it a lot easier on my father-in-law, who's 82 years old.
Gulf Coast Hospice of Houston, our family serving your family and making a difference day by day. Millions of people have periodontal disease or gum disease and don't even know that they have the disease or ignore the symptoms. This often silent and painless condition can be more than just a gum infection. It can cause severe damage to the gums, bone support for teeth, and even tooth loss. More and more studies show that periodontal disease can affect your overall health.
And I would just have bleeding sometimes, and after the examination, I had some recession.
Perio Health professionals, board-certified periodontists Drs. Michael K. McGuire and E. Todd Shire, and their highly trained caring team offer leading-edge treatment of gum and bone disease to help their patients prevent or reverse some of the health problems it can cause. Drs. McGuire and Shire are recognized by their peers as leaders in their profession, and they have built a world-class private practice and research center in Houston, Texas, which includes an educational facility where other dentists come to learn.
Many people don't even realize they have gum and bone disease. In fact, a lot of the new patients in my office don't really understand why they're here. And that's because there are very few symptoms in the early phases of gum and bone disease. And because of that, the disease can be underdiagnosed. When symptoms do occur, oftentimes it's bleeding when you're brushing, or perhaps sensitive teeth, or bad breath, or food getting caught between your teeth because of gum and bone recession. When symptoms occur later on, oftentimes it would be loose teeth or maybe even gum abscesses. You get into trouble with this disease one of two broad routes. Either through a period of neglect where you couldn't or you don't have your teeth cleaned often enough and you're not practicing good daily home care, effective brushing and flossing, or through a sensitivity to the disease itself, or a combination of the two. What happens is the bacterial plaque accumulates at the gum line. That creates inflammation, and the inflammation then destroys the gum and the bone around the teeth, leading to tooth loss if the disease isn't treated. This certainly is not a disease that you want to wait till it hurts, because by that time it may be too late to save your teeth.
Now, it might surprise you to find out what type of health problems that gum disease can lead to.
Gum disease is not just a dental problem. With more and more studies forthcoming, we are linking the level of inflammation in the oral cavity to diseases like heart disease, diabetes, osteoporosis, and even stroke. It's more and more important that we are taking care of our mouths to prevent the level of inflammation in our mouth compromising other parts of our body. The most important step in treating gum disease is an accurate diagnosis, taking into consideration all the patient variables that present. The first step in treating gum disease is often removing the bacteria at or below the gum line, secondarily coming back and correcting any lost bone or gum tissue. If treated, this allows us to save our teeth in health and function for a lifetime.
The treatment has resulted in me feeling better. The disease I had was affecting my entire body, not just my mouth, even though I didn't even feel in my mouth. And I feel better.
When you smile, if you show too much gum tissue, we can gently raise the gum, giving you a more pleasing smile. Think of it kind of like a gum lift. On the other hand, if you're starting to get a little long on the tooth, we can actually turn back the hands of time by placing gum tissue back over the roots of the teeth. It's because of these and other procedures that we're known as Houston's Smile Engineers. And in fact, we are world leaders in materials and techniques that allow us to perform these procedures in the most gentle way possible.
Now, if you're embarrassed because you're missing teeth, dental implants are the next best thing to your real teeth.
You know, losing teeth is not a normal part of aging. All of us should be able to keep our teeth for our lifetime, assuming good dental care. But sometimes, despite our best efforts, teeth are lost due to dental decay, gum and bone disease, or trauma, and some people never develop all of their teeth.
Dental implants can help you smile with confidence and may also help improve your health by removing hopeless teeth and infection.
It's important to replace missing teeth because if you don't, it can cause your facial features to collapse, making you look older than your years. Missing teeth can also lead to problems with self-esteem, problems with communication, and sometimes headaches because of a bad bite. Missing teeth can also lead to problems with your general health, such as malnutrition and poor digestion.
The dental implant procedure has become simpler and quicker for the patient.
Our office has been specially trained in computer-guided implant dentistry. We also are involved with training other dentists on this great technological advancement. This technology allows us to precisely place the implants on a computer screen prior to ever touching the patient, ending up with implants in the most appropriate position for a functional and aesthetic outcome. This will allow our patients to be more comfortable during the healing process, function quicker with being able to place provisional on these implants the same day of surgery, and ultimately help the patients become renewed as far as their function and aesthetics. We feel it very important, with all the advertising being conducted on Teeth in a Day, to seek expert consultation on these sometimes costly and expensive procedures.
My upper teeth were, in lack of high-tech terms, not in very good shape. So it was determined that the thing to do would be to remove them and put the implants in. So it's been a good experience overall, very good.
At the world-class office of Perio Health Professionals, you'll experience optimal, personalized, state-of-the-art care for all of your periodontal, oral medicine, and dental implant needs. Long-term acute and rehabilitation care is very important for people who are recovering from a serious injury, illness, or surgery. HealthSouth hospitals are making a difference. They design customized treatment plans that help promote recovery, independence, and help their patients regain their strength, relearn skills, or find new ways to deal with everyday life, allowing them to live without limits.
HealthSouth facilities in Houston